My name is Nicole Jakub, and I'm going through timed intercourse to try to have a baby. Right now, the reason that we are unable to conceive is called diminished ovarian reserve. The best way to explain it is every woman has a set number of follicles in her ovaries whenever she's born. And over time, the biological clock kicks in. So these follicles, if you will, they all kind of like lose their quality and quantity. So my quality and quantity is about a 40-year-old's, and I'm only 30. And that means that my lifetime conception chances are maybe 5% with treatment. Our treatment plan began essentially March 30th, 2017. We had an appointment called a POT appointment, plan of treatment. That's where I was told about my diagnosis, DOR, diminished ovarian reserve, and I was told that my ovaries don't stimulate. There's nothing that will make them. So we went ahead and started what's called a hyperstimulation, or maybe it's a mega stimulation. I can't even keep it straight. And we started in October. I think it was October 28th, 2017. And it was really miserable, to be honest with you. It was horrible. And we've already done 2, so we'll have done 3 total. It is really, really rough on my body. It gives me, like, my eyeballs hurt for probably an hour after the shots. And I have a high pain tolerance, so I hate it. And my emotions go everywhere. I don't even know who I am. And the worst part of it, the absolute worst part of it, I think, is trying to decide if a negative pregnancy test or a period is worse than going in and seeing that your ovaries looked like they were working, but they're not. So you struggle with, am I a woman? Because, they worked and then they quit working. Or do you wait until you get to the trigger and then feel like, are you a woman because it didn't work and you don't know why? It's very emotional, and it's not the most fun thing ever, so I'm just trying to get it out of the way. A lot of people think that we're doing IVF. IVF and timed intercourse are different because, well, they're not all that different. They both start the same way. We both have high levels of medicines injected into us. And in fact, even the doctors tell me that I am a typical IVF patient, except for when it comes to their difference, which in IVF you have a retrieval. And they monitor your eggs, and I don't know what the baseline for how many eggs they want you to have before they take them out. As for me, we're just hoping for 1. So IVF, they would go in, they would take out the eggs, and then they would take them to a laboratory and then, go from there. And then they put them back inside you. Whereas with timed intercourse, we just watch the little follicle and we trigger it and we have timed intercourse and hope that that follicle gets fertilized. This journey has really been very difficult, especially the shots and the emotions that come with the shots, and looking at the ultrasound screen like on a Friday, and you see all these little things there, and then they're gone on Monday, and then they're completely gone on Thursday. I don't want to do it again. This is the last round. So our next step, I think, is embryo adoption or egg donor. The difference is egg donor would be, we would choose a woman, whether it be anonymous or not, and she would give us her egg, and then my husband's sperm would fertilize it, so the baby would be biologically his, and then I would be the carrier, and I would give birth 9 months later. Embryo adoption is basically when couples who've done IVF, they're just done having kids, and they still have leftover embryos, they give them up for adoption. So it won't be either one of our biological child, but I still carry it for 9 months, and I still give birth to it. So one of those 2, probably egg donor, is our next step. We've thought about if egg donor and embryo adoption didn't work, we would absolutely consider doing traditional adoption. I think we want to do it anyway, to be honest with you. So even if those things do work, we want to still adopt baby because babies need mommies and daddies. A lot of women, and I'm not trying to come down on anyone, a lot of women think that having a biological child is the end-all be-all. And if it doesn't happen, they're not open to anything else. So at the end of the day, I have to ask myself, Is it more important to be a mom, or is it more important to be a mom to a biological child? And if I'm honest with myself, it's more important to be a mom. And that's what gets me through all of this. It's just knowing that I'll be a mommy one day, some way, somehow. Wipe down all the tops. Nothing special about that. They just want you to be extra sanitary. I don't really know what the point is at, honestly. So then we're going to open the syringe and the Q cap. You might want to come close for that. Goes right on top and twist it, just like this. And pull down to 1 cc. Is that it? Right there?
Mm-hmm.
And then the first to go is going to be the sodium chloride. So you push the air down into it.
Mm-hmm.
And then it comes out. Oh, watch for it. Sorry. And there's still a bubble. I hate those. It should be fine. So now we have the 1 cc of sodium chloride. And Minopure at first, it's powder, but it's not dissolved the way it should be.
Mm.
So this is going to be a fun shot for you, by the way. Watch how fast it dissolves. And then we have to swish it. And then we're going to do the same thing for the next 3. So there's nothing new for that. Okay, he's going to have to show you how to do the rest because I don't put the needle on the end. Baby. And I'm going to find my oven mitt or something to squeeze because this hurts right here. Just do it slow enough for her to, oops, sorry, be able to get a good one. I don't want to do this. He took off the Q cap. And then he's going to get ready to poke me. Do you need some white or something? I'm ready for you.
You gotta let it dry first.
If you don't let it dry, it burns like a mofo. I think that's good.
And the bevel's gotta be facing down, and the needle goes in about 45 degrees.
Hi, Tegan. And that's how it goes.